How do lung function tests confirm an asthma diagnosis? Imagine trying to breathe through a narrow straw. That's what it can feel like when your airways are inflamed or blocked. Lung function tests help doctors see if this is happening. They measure how well air moves in and out of your lungs. These tests also check how your lungs respond when given medication or exposed to triggers. This way, doctors get clear, measurable proof of what's going on inside your chest. The most common test used is called spirometry. During spirometry, you take a deep breath and then blow out as hard and fast as you can into a device called a spirometer. This device records two key numbers. The first is called the forced vital capacity. This is the total amount of air you can exhale after a deep breath. The second is called the forced expiratory volume in 1 second. This measures how much air you can blow out in the first second of your exhale. In people with asthma, the airways are often narrowed, so the forced expiratory volume in 1 second tends to be lower than normal. After the initial test, you inhale a medication called a bronchodilator. This medicine relaxes the muscles around your airways and helps open them up. Then, you repeat the spirometry test. If your forced expiratory volume in 1 second improves significantly after using the bronchodilator, it shows that your airway narrowing is reversible. This reversibility is a key sign that asthma is the cause of your breathing issues. Another tool used is the peak flow meter. This small device measures how fast you can blow air out of your lungs. By regularly checking your peak flow, you can see if your lung function changes over time. If your peak flow readings are lower during symptoms and improve after treatment, it supports an asthma diagnosis. It also helps you and your doctor track how well your asthma is controlled. Sometimes, if spirometry results are normal but asthma is still suspected, doctors might do a bronchial challenge test. This involves exposing your airways to triggers like methacholine or exercise. If your lung function drops significantly after exposure, it indicates your airways are overly reactive, which is common in asthma. Other tests like measuring lung volume or checking for inflammation in the lungs can also be done. But for initial diagnosis, spirometry and peak flow measurements are the main tools. They give objective, clear evidence of airway narrowing and its reversibility. This helps doctors confirm if asthma is the cause of your breathing problems. These tests also help determine how severe your asthma might be and guide treatment plans. In short, lung function tests confirm asthma by showing that your airways are narrowed and that this narrowing improves with medication. They provide concrete data that, along with your symptoms and medical history, lead to an accurate diagnosis.